The secrets to home care success. Important information to consider when hiring in-home care services. You've been searching for answers. You've talked to family. You've talked to friends. You've searched online. You've heard from many providers about their services. Where do you go from here? Wouldn't it be great to find all the answers in one place? For instance, how much does in-home care cost? How do people pay for in-home care? Does Medicare pay for anything? What about Medicaid? How do I choose the right provider? How do I know my loved one will be safe? How do I know that my loved one will even agree to any of this? Here's an idea about the cost of care and how people generally pay for it. National average daily rate for a private room in a nursing home is $206 or $75,190 annually. The national average daily rate for a semi-private room in a nursing home, $183 or $66,795 annually. The local average hourly rate for non-medical in-home services is $18 to $25 an hour as needed. There are various payment resources available. Private pay, using your own income, assets, and investments. Long-term care insurance, insurance that pays for care at home, in assisted living facilities, adult daycares, and nursing homes. To qualify, you must meet health requirements, and you must be able to afford it. Reverse mortgage, home equity conversion mortgage, or HECM. It allows you to use the equity in your home to pay for long-term care insurance or to directly pay for in-home care. Government assistance, you can apply for Medicare and Medicaid benefits. Veterans assistance, veterans or their widows may qualify to receive financial aid to help with care cost. Medicare is an insurance program run by the government that provides seniors and people with disabilities hospital, medical, and surgical benefits. What Medicare pays for: short-term rehab care in a nursing home, skilled in-home nursing care for 30 days, 90 days of nursing home care if you qualify. Average qualified payment is for 26 days. What Medicare does not pay for: custodial care in a nursing home, non-medical in-home care, adult daycare, and assisted living. Medicaid is a program run by the federal government and the state where you live. It helps impoverished people pay for long-term care. Medicaid qualifications: you must meet certain income and asset qualifications depending on the state where you live. You must spend down checking and savings accounts and investments before qualifying for Medicaid. You can keep your home as much as $500,000 in value, one car, one life insurance policy with cash value less than $1,500, a prepaid burial plan, and your personal effects. Medicaid limits: Medicaid covers care in a semi-private room in a nursing home. Nursing homes lose money on Medicaid patients, so facilities limit available Medicaid beds. And long waiting lists and facilities miles from home are not uncommon. Looking for information on what programs and services are available in your community? In the Chicagoland area, the best place to start is with your local Area Agency on Aging. In Lyons Township, Aging Care Connections at 708-354-1323. In DuPage County Human Services at 800-942-9412. Reverse mortgages and the VA offer additional payment assistance options for in-home care. Provide tax-free proceeds that can be used to pay for in-home care as needed. You can find out more at reversemortgagenation.com and 1-800-VETERAN.com. It's important to understand the differences between home care agencies and caregiver registries. The key difference between agencies and registries is the caregiver's employer. Registries or referral services do not employ their caregivers. Agencies take full responsibility for employing their caregivers. In the state of Illinois, all agencies and registries must be licensed by the Illinois Department of Public Health. Please ask to see a copy of their license. Comparing agencies to registries. Home care agencies employ, train, and supervise their employees. They are responsible for making sure care is provided to the patient. Home Helpers is an agency. They interview, check references, and do a criminal background check on caregivers. They manage and supervise the caregiver. They maintain a payroll system, pay the caregiver, and provide records to the government. They withhold and pay taxes on the caregiver's wage. They insure caregivers with workers' compensation. They arrange for substitute care if the caregiver is absent. Registries act as a matchmaker service, sending an independent contractor to patients. They may not interview, check references, and do a criminal background check on caregivers. Registries do not manage and supervise the caregiver. They do not maintain a payroll system, pay the caregiver, and provide records to the government. Registries do not withhold and pay taxes on the caregiver's wage. They do not insure caregivers with workers' compensation, and they may not arrange for substitute care if the caregiver does not show up. It's important to understand the differences in liability between agencies and registries. With registries, the client or client's family bears the burden of screening, payroll, taxes, insurance, training, supervision, and ensuring care is provided as requested. How do I know my loved one will accept care or support? Clearly define the situation with your loved one. Discuss with your loved one his or her capabilities and limitations. Discuss current needs and possible future needs. Talk about different options for care. Understand your loved one's perceptions of possible care arrangements. And agree on a solution. Second, work to find a caregiving solution that meets your loved one's needs and desires safely. Match your loved one's needs and personality with an experienced caregiver with the skills that will provide the best care and companionship. Be sure there is professional oversight of the caregiver to be sure services will be provided safely. Be sure there is supervision in place that delivers ongoing assessments of care and recommendations as your loved one's needs change. How do I know my loved one will be safe? Look for these indicators that a caregiver is well qualified and likely to provide caring, compassionate, skilled care. The caregiver is carefully screened before coming to your home. The caregiver is bonded, insured, and covered by workers' compensation insurance. The caregiver is experienced in specialized care that your loved one may require: Alzheimer's, dementia, arthritis, or mental and physical challenges. Home Helpers caregivers give experienced, dependable, safe in-home care. They're carefully selected for their training, experience, and demonstration of compassionate care. They are thoroughly screened, bonded, and insured by workers' compensation. They are professionally supervised, with a supervisor making ongoing assessments and recommendations as your loved one's needs change. Many of our Home Helpers caregivers are trained and experienced in specialty care, including Alzheimer's and dementia, stroke care, arthritis, MS, and Parkinson's, special dietary needs, and other mental and physical challenges. Home Helpers care plans are tailored specifically for your loved one. The services we provide can change as their needs change. Some of the services our caregivers provide include companionship, bathing and dressing, light housekeeping, grocery shopping, meal preparation and feeding, transportation, errand services, and much more. Home Helpers provides personal, attentive, experienced care. in the comfort and privacy of your home, assisted living center, retirement community, or wherever we're needed. Many Home Helpers clients supplement the in-home care with a personal emergency response system. Direct Link, in-home emergency monitoring. Anytime your loved one needs help, they simply push the button that's worn around the neck or wrist or as a belt clip, and our professional staff will respond immediately. Based on your previous instructions, we will dispatch an ambulance when necessary, have a neighbor check in if it's a non-emergency, notify a family member of the situation, or call your loved one's doctor. Direct Link gives seniors and their loved ones peace of mind by allowing them to live safely and independently. Here's more about Home Helpers.
Does someone close to you need help remembering medications? Is everyday life becoming more and more challenging? You want them to stay active and independent, but think home care is too expensive? Let Home Helpers provide personal, non-medical in-home caregiving for seniors, expectant or new moms, even someone recovering from injury. Affordable, compassionate care for your family and you. Call Home Helpers for a free consultation because a little help can make all the difference.
So, what's the next step? Contact our office at 708-783-1220 or 630-323-7231. Or you can visit our website at www.maryandmikecare.com.